Good afternoon, I am Kayla Parker. I'll be presenting various professional qualities of a sonographer. This will include multiple categories such as appearance, ethical and legal aspects, written and verbal communication, and lastly, professional issues. Please enjoy. First, appearance. We don't always have multiple encounters with a patient, so it is crucial that we do everything we can to ensure patient comfort. A sonographer's attire is quite simple. Wear scrubs, closed-toed shoes that allow for comfort and safety, and an ID badge. Personal hygiene. Long hair must be tied back so it remains out of the way when interacting with patients. Fingernails need to remain short. No fake nails are permitted, as this could transport germs and affect the health of a patient. Wearing scented perfume is another form of personal hygiene that can negatively impact patients. Some patients may be allergic or have high sensitivities, so refrain from wearing perfume. Nonverbal. Sonographers must exhibit a warm and kind demeanor, as this could be the best interaction the patient has all day. Eye contact. Keeping eye contact with patients portrays confidence and begins the opportunity to build trust. Posture. Stand up straight, not crossing arms, and nodding when listening to a patient are simple ways to show kindness and allowing the patient to feel heard. Ethical and legal aspects. Integrity and honesty. Having integrity is simply doing the right thing even when nobody is watching. In the medical field, doing the right thing is always the best choice. If we do not know the answer to something, that's okay. Ask questions to ensure the best decision is made. Informed consent. Patients have the right to know what is going on. It is the sonographer's job to inform the patient of the procedure that will be performed. Before performing the procedure, the patient must give consent. Accurate documentation. It is the role of the sonographer to remain goal-oriented when scanning. Always scan what is requested. Following a scan, sonographers make a report. The report must contain accurate information regarding the exam. Without proper evidence, it could be invalid. Confidentiality. This is, in simple terms, keeping things private. When discussing a patient, only approach those who are also caring for the patient, such as their nurse. Remember, do not always discuss anything regarding the patient in the open to other coworkers or friends. We must respect their privacy. Written and verbal communication. Clear explanations. By using clear and common terms when speaking to a patient or family members of a patient, a sonographer can build trust and ease nerves. When a patient understands and trusts you, you may open the door to more, such as the patient being more compliant, calm interactions, and mutual respect. Address clinical findings. In the report following an exam, clearly address sonographic findings so the physician can evaluate it. A sonographer's report is also a form of communication between them and the physician. They must make sure their work is clear and concise while still addressing anything that may have been found during the exam. Empathy and compassion. These characteristics may come easy to some, but not all. Sonographers should show empathy to receive trust from their patients. This is understanding and feeling their emotions. Showing compassion is expressing concern for the situation the patient is in. Empathy and compassion can be shown verbally through words and non-verbally through body language and facial expressions. Effective collaboration. No matter where you land as a sonographer, there will be many kinds of people and personality types. It's important to remember that a sonographer is present for high-quality images and patient care. You must be able to work as a team to be successful. Lastly, professional issues. Scope of practice. Sonographers have a scope of practice. Remaining in the boundaries of this ensures the sonographer is reliable, trustworthy, and representing themselves well. Refrain from participating in situations that you are not qualified for. Maintain registration. Once a credential is obtained, a sonographer is required to remain competent and meet the standards each year. Whether a sonographer is registered through ARDMS or CCI, they pay an annual fee and every few years complete a required amount of continuing medical education. Participating in organizations. Take opportunities to engage in professional organizations such as the Society of Diagnostic Medical Sonography or Society of Vascular Ultrasound. Other experiences like taking on a leadership role or teaching could arise, as this could serve as a great advantage. These examples are great ways to not only strengthen a resume, but also create a network with others in the field. This concludes my presentation, Professional Qualities of a Sonographer. Thank you.